Hello there. I'm Dr. Srishti Mohapatra, and I'm one of the internal medicine consultant and aesthetic physician. And I also lead the research and development wing at India's biggest longevity and aesthetic clinic chain. In this review, it is not just only for the business owners. It is also about the patients so they make smarter decisions and smarter selection of what exactly do they want. The ease of use, the tech breakdown, patient suitability, speed of results, training support, satisfaction, numbers on the costs, financing, profitability. So one of the most uninvasive treatment, which is not going to put on and poke on needles into your face without scalpels and has been in the market for quite a few time, is high intensity focused ultrasound, which is also known as HIFU. Now, coming to the tech and ease, it is very much similar to how therapy works, but there is no visualization. So it is all manual and all according to the precision that the clinician has. It can target areas even on the belly fat and laxity, but it would require more sessions. It totally relies on the transducer mapping and how you're going to scale up using your white pen on the skin. And the training here generally is required within 1 week. The person or the practitioner who's doing HIFU can get trained within a week as compared to what we were talking about in therapy. The contraindications again here remains that people who are epileptic, are more than 4 drugs for psychiatric issues, or people who have a pacemaker at their heart or have any active infection on their face should be avoiding that. Now, which patient should actually go for therapy? Again, moderate to mild laxity of the skin, and also people who want lift around their jawlines are the people who should be going for HIFU. The results generally start to peak up within 1 to 3 months and they show up on your skin. Generally, the results peak up by 6 months, but patients generally need 2 to 3 sessions per year to maintain those results. This works through neocollagenesis, that is denaturing the original collagen which was already present in the face and then creating new collagen into your face. Right. So the per session charge can go up to varied across 250 pounds to 500 pounds, depending upon where your clinic is, where you're practicing. And generally, to acquire this machine, you would have to spend somewhere around 50,000 to 60,000 pounds. The return of investment generally returns here quickly, which is 150 to 200 patients, and which can be done within 3 to 6 months of an active clinic, which is running nice. Now, from a patient's viewpoint, therapy is something in comparison to HIFU more comfortable because there is more precision. So there are not more shots to it. HIFU works on shot basis, how many shots you're actually delivering on the patient's face. HIFU is somewhere affordable. You can have more patients coming back to you time and again within 3 to 6 months when they need more results and neocollagenesis as compared to the other machines in the market. So overall, when we talk about HIFU, it is one of the great purchases if you want to start somebody who's a beginner or if you want to start low or somebody who's a bit not easy on your pocket. And if somebody who's on a budget but still wants that amazing lift, you should go for HIFU. And HIFU, again, it's technically very safe. A lot of people can have that, apart from people on pacemakers, epilepsy, pregnancy, or breastfeeding. And it has no needles. So, of course, hypertensive patients or people who are on thyroid medications or diabetes who have a little more healing time can go for this treatment for neocollagenesis and better results.